Good afternoon, everyone. This is Carolyn Allshouse. I'm the Executive Director of Family Voices of Minnesota. And thank you so much for joining us today on this webinar. I think that even though there are a few people who will still be joining us, we should go ahead and get started. I just wanted to let you know that I have started the recording, so this webinar is being recorded so families can play it back at future times. If you have questions or comments, please feel free to chat in the chat box, and we will be opening up the phone lines for questions and answers after the presentation. So let's get started. So first of all, I wanted to let you know that Family Voices of Minnesota is a nonprofit organization located here in Minnesota. We are the state affiliate organization of Family Voices National. There are Family Voices organizations located throughout the country and in almost every state. We are also the state alliance member of Parent to Parent USA, and one of our major programs is the Connected Parent to Parent Peer Support Program. So we are happy to have these affiliations with these other great national organizations. One of the other things I'd like to mention is that here in Minnesota, we do have staff that are located regionally around the state and are there to connect with families on an individual basis. We also have staff located in the metro area to connect with families. So if you're a parent and are interested in talking with another parent, all of our staff are parents who have children with special health care needs or disabilities. And we'd be very happy to provide information and assistance. So sometimes throughout this presentation, you're going to hear me talk about the term children and youth with special health care needs. And I wanted to share a little bit more about what that term means and what the definition of children and youth with special health care needs is. It's a term that's been coined by the Maternal Child Health Bureau, and it is children who have or who are at increased risk for a chronic physical, developmental, behavioral, or emotional condition, and who also require health and related services that are greater than what children require typically. So this is a very, very broad category of children, and I think it's important to mention that here as we get started, that we're not just talking about health care issues in children, but we're really talking very broadly about those children who have any kind of condition, and that is what the term children and youth with special health care needs means. So if you hear me refer to it, that's what we're talking about. In Minnesota, and actually nationally, 1 in 5 families who have children have a child or more than one child with a special health care need or disability. So I think that's a little bit of a humbling statistic, and one that I think other parents benefit from knowing. In Minnesota, it's estimated that there are between 160,000 to 200,000 children and youth with special health care needs. So if you're a family member who has a child with special health care needs, you're not alone. So I don't know how many of you have been in this position, but I just want to talk about Charlie for a minute. Charlie is a little boy that has multiple diagnoses. He has a G-tube. He has 15 specialty doctors. He started running a fever after dinner, and his G-tube is kind of red and it seems a little bit sore. His family isn't really sure who to call, if they need to call somebody that night or if they need to wait until tomorrow. And what about Josh? Josh has cerebral palsy and a seizure disorder. He's got 12 different specialists, and he woke up during the night vomiting and running a fever. His family isn't sure if they should take him to the emergency department or wait until morning and call their primary doctor. I'm wondering how many of you have been in this position where it's been the middle of the night or after office hours or maybe even during the day during regular office hours, and you're not really sure who you should be calling about what's going on with your child. That's what we're going to be talking about today. We're going to be talking about how to be prepared for acute illnesses with our children. We're going to be talking about a few different things. We're going to be talking about the role of primary care, and we're going to be talking about communications with specialty physicians, and we're going to be talking a little bit about the communication between primary care and specialty physicians. We're going to be talking about planning for acute illnesses and what that might look like for your child. And we're going to be talking about a couple different tools. One in particular is the Emergency Information Form for Children with Special Health Care Needs. And this is a link to that tool, which I don't think you can actually access from here. But for those of you who are interested, we will send out this information by email to everyone who's participated in today's call. So my first question is, does your child have a medical home? And what the heck is a medical home? I think the bigger question might be, does your child have a primary care doctor, and do you really utilize that primary care doctor, and why do you need a primary care doctor, or why might you want a primary care doctor? Some families, especially like Charlie and Josh that we talked about a few minutes ago, they have so many different specialists and they see so many different doctors, and they may have multiple appointments over the course of the year that fitting in an appointment with primary care may seem unnecessary to some families, and it may seem like a waste of time. But I think it's something that parents really need to think about, because unfortunately what happens is with specialty care providers, they often are very focused on their body part, the part of your child that their specialty focuses on is what they focus on. And it means that other than you, there may not be a physician or nurse who's looking very broadly at your whole child and all of those pieces that make up your child. And there may not be anybody who's really looking at preventive care and all of those sort of typical parts of health care that all children require, no matter how many different conditions that they have. And that really is the role of primary care. The primary care doctor or primary care nurse practitioner is the person who should be able to look at the whole child, be able to look at all of the child's conditions, and be able to help you coordinate care. Many years ago, the American Academy of Pediatrics spent quite a bit of time focusing on the idea of a medical home for children and youth with special health care needs. And they really defined a medical home as a primary care clinic and doctor, or in some cases it might be a nurse practitioner, that has a structure within their clinic that includes a place for sort of that central headquarters for care, where care can be coordinated. It's a place where you're recognized and people know who you are and know your child. It's a place where you should have positive, respectful, and trusting relationships with your child's doctor. It should be a place where you can also learn about connections to community resources, and it should be a place where there's proactive planning. Unfortunately, not many families really experience a true medical home. And I have to add to this that in Minnesota, we also have a system called healthcare home, which is a medical home that receives some certification from the Minnesota Department of Health to provide these kinds of services to people with chronic conditions and can receive payment for providing care coordination. Unfortunately, there are not a lot of certified health care homes in Minnesota, but there are many pediatric clinics who are really dedicated to providing a medical home. And I would encourage you to think about whether or not this describes the primary care clinic or primary care doctor that you have and that you work with. And if not, if this is something that you want to look for in a primary care doctor, something you may want to talk with your child's primary care doctor about, and whether or not they can help you provide this kind of care for your child. You really need somebody who's able to look at the whole child. And we're going to be talking about why that is important a little bit more as we go forward here. So hopefully you have that person who can help you coordinate care. And I think it's important that if you do not have a plan of care that you've developed with your primary care doctor or one of the specialists who you work very closely with, that you should ask for that. This is a tool that families can use to better coordinate care and to better communicate the needs of your child with specialists, with other providers in the community like therapists, potentially with the school, potentially with home care. All of those different providers that you may work with would really benefit from having a comprehensive plan of care that can be shared among different providers. So when you're talking with your child's primary care provider or specialty care provider about wanting to develop a plan of care, some of the things that you need to be thinking about is how often does that plan of care need to be updated? It may need to be updated frequently if your child's needs change often, or updated when there are changes in medications and that kind of thing. You need to be thinking about how you can use it as a communication tool with other doctors or with your team members, as I previously mentioned. And we're going to be talking a little bit more about communication as we go along here. And it's something that you should be able to bring with you to all of your appointments, and hopefully something that you can keep on your own computer or tablet so that it's really accessible to you. One of the things that it's going to have to start with is really making time to talk with that primary doctor or specialty doctor about developing that plan. The plan should include, and I'm going to kind of give you a list of things that could be included in a plan of care, but it should also talk about potential acute issues that could arise and what to watch for and talk about and who to call when you have an acute issue that comes up. You also need to talk about what is an emergency for your child and talk about where you should go in an emergency. So every child is going to be different. Their needs are going to be different. The issues that may arise are going to be different. So what constitutes an emergency for your child may be different than what is going to be an emergency for another child. It's very surprising to me how infrequently we talk about emergency care and what constitutes an emergency. And it's something that we as parents can bring up and should be bringing up, because it's really part of what we want to know and need to know in case something happens with our kids that is unexpected. Oftentimes, specialty physicians will talk with us about a specific condition and what constitutes an emergency for that specific condition. But we need to be aware of what constitutes an emergency for all the different conditions that our child may have. So when we're talking about just a regular plan of care, these are some basic things that you would want to include in a plan of care. Obviously, your child's name, address, phone number, the date that this plan of care was created or revised, your child's name. It's important to talk about your child's and describe your child's condition. So the current status of the condition or current changes that have happened. It should list the doctors that are involved in your child's care, and you may want to include the last appointment that you had with that particular doctor specialist. It could include things like recommendations from the last appointment, when the next appointment is needed, and if there's a referral needed. These kind of details will be especially helpful if your plan of care is able to be on a computer so that you're able to update this. It should obviously include current medications, but one of the things that it should also include is how those medications are given. Are those medications taken orally? Are they taken through the G-tube? Are they given intravenously? So it should include the route of administration and how often they're given. Some of the other things that can be really helpful to include in a plan of care like this would be things like what's normal for your child, or things that work or don't work for your child, like when you're drawing labs. It may be really important that a lab draw occurs in a certain way, or that you're certain to have your child's comfort and safety toys with them if they're going to be having a lab draw. It may also include things like, where it works to draw your child's labs and where it doesn't work. A plan of care like this could also include upcoming tests or procedures, and then it could include a follow-up on recent tests that are needed. It can also include updates or outcomes of certain tests that might be important to have as part of this plan of care. It also, there may be other issues that you think of that are very specific to your child. Sometimes a plan of care can include very specific goals, similar to an IEP. It may not be educational goals, but it may be clinical or medical goals. It may be other kinds of developmental goals that would be important for your child. And it should also, or could also, include goals that you as a family have, like, one of the goals that you as a family might have would be to be able to go on a vacation. And it's not inappropriate to put a goal like that on a plan of care. It's something that you as a family feel is important and something that you want to work toward achieving. And it's important that your child's doctors know that that's one of your goals as a family, and that it's something that maybe we need to get our child stable enough and have enough proactive plans in place so that our child and our family can go on a vacation. You may also want to include things like follow-ups that are required and the date of the next update that might be needed in this plan of care. So this is just talking about a typical plan of care that can be very helpful for families to be proactive and can use as a communication tool and can be taken with you when you go to your doctor's appointments and can really help to have everybody know sort of this bigger picture of your child. So quite a few years ago, this is something that my child's primary care doctor and I worked on, and I used to take it with us to all of the specialty care appointments. And one of the specialty care physicians took a look at this and said, "This is so wonderful. This really gives me a wonderful big picture view of what's going on," because it wasn't something that he typically really ever saw, and really only was able to focus on that particular part of his specialty. So you may be surprised at how valuable this kind of a tool will be to the specialists that you work with. One of the things that can be either a standalone document or can be part of your regular shared plan of care is the idea of having an emergency plan. And this is the plan that really focuses in more on what happens when there's an acute problem. And as we talked about sort of some of the things that might be part of a regular plan of care, we're going to be kind of covering some of those things that might be part of that here in this emergency information form, but it's in a much more condensed version. A regular shared plan of care might be a few pages long. An emergency information form is 2 pages long. It includes a lot of really quick, fast information. Both of these proactive plans of care can be really helpful just on a day-to-day basis when you're at home and you're doing your regular schedule, but also might be really, really important if you are able to go on vacation and go out of town. If your child gets sick when you're out of town and you need to go to the emergency department and you're seeing a group of providers who've never seen your child, they don't know who you are, when you can approach that emergency department with a plan that's from your child's doctors, that's going to be not only extremely helpful to those doctors seeing your child for the very first time, but it's going to be a helpful way to communicate your child's needs in that kind of an acute situation. This kind of a planned, proactive approach is also going to be really, really important if the parents want to get away or one of the parents needs to get away. And if you're leaving your child with someone who may not be as familiar and may not have the level of detail that parents often have about their children. Maybe you're leaving your child with grandma and grandpa, and you want them to feel comfortable and know what to do if your child gets sick, but you want to feel comfortable that you've put in place a good proactive plan that will help you communicate your child's needs when you're not there. So, an emergency information form is a real actual document, and it was something that was developed by the American Academy of Pediatrics and the College of Emergency Physicians, and it was actually something developed probably 20 years ago or more. And it's still an appropriate and useful tool that unfortunately is underused and parents never hear about. So that's why we wanted to talk about it with all of you so that you would know about it and be able to use it as a tool if you think it would be helpful for you. This is what it looks like. And I'm going to give you the links. You can download it so you can fill it in on a computer and in sort of multiple different ways. So we can send out some links that will help you download this. And I know it's probably a little bit hard to see what it includes, but it includes that sort of basic contact information. And it also includes some information about the physicians that your child typically works with, along with an emergency phone number for those physicians. Now, you'll notice that it also doesn't include room for 15 different physicians on here. It's really, the idea here is to think about who are the physicians or the people in the healthcare system that know the most about your child and would be the most helpful to respond in an emergency. You'll also see that it includes a diagnosis. It includes some past procedure. It includes baseline physical findings. So that, for example, if your child's typical baseline is untypical, but normal for your child, it would be really helpful to be able to have that information here so that if you're taking this to an emergency department and the emergency physician kind of starts freaking out because something is very unusual, but it's normal for your child, that's really important information. The second page of this document includes some past procedures that would be important to note. And these are going to be the most important things. It's not going to list every single surgery your child has ever had. It's what are the most important things that people need to know. And it would include things like also typical protocols or what might be called management data about your child. Are there some typical things that you would do or typical protocols that would be in place when your child is ill? So, for example, if your child has allergies and they shouldn't be given a specific type of medication because they're allergic to that medication, or procedures to be avoided. This may be very important for certain conditions. There may be procedures that should never be done on your child. So it would be important that information is on here. Obviously, medications would be important. Immunizations might be important. And then there's a place for common presenting problems and specific suggested managements for those problems. So, for example, a child that has a central line, there may be a typical or specific suggested management if a child is running a temperature over 101, as an example. The typical protocol may be that the child needs to have lab work drawn to look for potential infection. There may be prophylactic antibiotics started. So there may be sort of some typical issues that would come up based on your child's condition, that there would be some typical management that would be suggested. So as you can see, we're sort of condensing information here to talk about what might be the most likely things that we would be concerned about and how do we deal with those likely things. So as I mentioned, the American Academy of Pediatrics and the American College of Physicians feel that this is an important tool that will help facilitate information for children who have special health care needs. And it's being able to relay that information to emergency physicians and to other people who you may seek out in an emergency. On the web link that we'll send to you, it includes the ability for you to download this emergency information form. It shows you a sample of a completed emergency information form to kind of give you an idea of what that might look like. It gives you a blank interactive form where you can fill it out online and save it to your computer. It provides some fact sheets, and then it also includes kind of just policy statements from the AAP and the American College of Emergency Physicians. And the reason that those might be helpful is that if you go into your child's primary doctor and you take this form in with you, you might want to take these policy statements in with you as well. Your doctor, your child's doctor, may not be aware of this emergency information form either. And so you could take in the statement and the form and say, I think this would be a really great way for us to be able to proactively plan in the event that my child gets sick. And would you help me fill this out? And by providing them with these policy statements, it gives these doctors a little bit more information about why these forms were developed and by whom, and gives a little bit of credibility to this form, that it wasn't just something that you randomly found on the internet. Not that that wouldn't also be helpful, but it just provides some basic information that would be helpful to your child's doctors. And then you need to be thinking about, so who do I need to be sharing this information with, both the shared plan of care and the emergency information form. So if you're working on this with your child's primary care doctor, who hopefully has that big picture view, and then you need to talk to your child specialists about these plans. Do they have anything to add or anything that they would want to change about the plans of care that you came up with? Are we all on the same page? So do we all know that this would be helpful and they know that you've got this in place? Gives you an opportunity to talk about these acute potential issues that might arise and what to watch for. It hopefully will prompt you to have a conversation with every one of your child's specialists to ask the question, what might be the things we should be watching for, and what do we do about them? And then talk about, who do I call if my child gets sick during the day or in the middle of the night? Who do I call? Because I think that's often one of the biggest questions that come up. Is this a GI issue? Is this an endocrine issue? Is this a normal childhood issue? Does my child have a virus? And then not only talk about who to call, but that idea of what's an emergency versus when do I just call to get more information? Do I need to go in the middle of the night, or do I go to the emergency department if I can't get into the clinic during the day? And then if I have to go to the emergency department with my child, where do I go? I think we frequently do not ask that question. Is it important because of our children's needs that we go directly to a children's emergency department at a children's hospital versus a closer local emergency department that may not have pediatric specialty care? That's a really important question to ask. Where do I go in an emergency? And of course, it may depend on how big of an emergency we're talking about. That's why it's important to have these conversations in advance of an emergency. And then I think we need to think about, are we all on the same page? What happens when I call the clinic in the middle of the night? Who do I get? And what clinic do I call? If I call the primary care clinic, who do I get? Typically, you get a triage nurse who is directed to decide if the person calling in needs to go right to the emergency department or should talk to the on-call doctor. Usually they have no information about your child and will always default to suggesting that you go to the emergency department, and that might not be necessary. It may be that you have a plan for this that just needs to be implemented, and you really just need to talk to the on-call doctor. But how is this information communicated within the clinic? So it used to be, years and years ago, that some clinics had what they call an on-call book. And for their children, for the children who have a specialized care plan, they may have all those care plans. This was years ago before the computer. They had all those care plans in a book, and the on-call physician would take that book home with them. And if you called in and your child had a care plan, they had the access to that care plan right there. Well, now we have electronic records. And so hopefully that care plan is in the electronic record at your child's clinic. And so the on-call physician can actually access that care plan by looking at the electronic health record. Not all clinics are set up in this way, but they're getting there. They're working on this. And your health plan should be part of your child's electronic health record, so that in the middle of the night, that clinic physician who's on call can access that information. But then what about if you go into the emergency department in the middle of the night and your clinic electronic health plan, electronic health record, your child's record at the clinic, doesn't connect to the emergency department that you're going to? So they use different electronic health records. So the emergency department physician doesn't have access to that information. That's where you need to be able to bring that information in and give it to that emergency room physician in the middle of the night, because you've got that with you, and you can provide that doctor with the information they need to treat your physician in the emergency department and to contact your child's physicians who are going to be most helpful in making decisions about what needs to happen. The next thing to think about is what happens if you need to call for an ambulance. So when this plan was first, this emergency information form was first developed many years ago, one of the things that was recommended to families was go and talk to your local responders in your community. The people who, if you call for an ambulance, they would be the people that would respond. It's not a bad idea if you think about it. Go talk to the lead emergency medical services person in your community and ask to set up a meeting and talk about your child's unique needs. Provide them with a copy of your emergency information form so that they're aware that this is important, especially for children who use very specialized medical equipment or may have specialized implanted devices that the local responders may not be familiar with, and they don't know you and they don't know your child. And so they may not be very well prepared to respond in an emergency situation. So again, if you are proactive and go meet with them and share this plan, they're going to have more information about your child. They may be able to flag your address so that if they do have to respond, they're prepared for the fact that your child has some unique needs that they need to be prepared to address. So think about who else might benefit from having a copy of your child's plan of care or the emergency information form. Might be really important for home care staff to know about this and have copies of it. It might be helpful for the school to have some of this information. There may be parts of this information that you don't necessarily always want to share with the school, but you may want to take out some of the information and share a more abbreviated version with the school nurse. But the school needs to be prepared for an emergency as well. We also talked about the emergency department and the local EMS. I'll just say one more thing about that, which is I would talk with your child's primary care doctor about whether a copy of this plan of care and the emergency information form could be on file in the emergency department. May not be practical, maybe, don't know. It depends on your emergency department. But where should you be keeping this plan of care and the emergency information form? Might be important to have it in your child's backpack when they're with them. It may be important to have it on your child's wheelchair. I know a family who took a PVC pipe and put taps on the end of the pipe that they put their child's emergency information form and plan of care in that PVC pipe and had it attached to the child's wheelchair and had it marked as emergency. And so if they weren't with their child or something happened, people knew that there was information in that tube that would be helpful. I know families that put that on their child's car seat. You may want to have it on your refrigerator at home. I don't know how many of you remember, and it's not very widely talked about, but many times in the senior community, they encourage seniors to have what's called a vial of life. It's a magnetic little tube on their refrigerator that included very basic, important emergency information if they collapsed in their home and were unable to communicate their unique needs. It's the same kind of a thing. Have it available if you're not available to speak on behalf of your child. Some of this is information you can keep on your phone if you need to. And there may be obviously other places that you will think of that will be important for you to keep this information with you and with your child. So this is a very kind of quick overview of thinking about the idea of proactive planning and having an emergency information form. And it's really just a very basic look at some of this. We do have another webinar that I think we'll be repeating sometime in the next few months that talks a little bit more in detail about how you can be a proactive partner in your child's care and talks about communicating more effectively with your children's providers. And if that kind of information will be helpful to you, you can maybe keep an eye out for future webinars. But I would like to take a minute now and open up the phone lines or unmute them so that if
the conference has been unmuted.
So if you have any questions or comments that you would like to share, we'd love to hear them.
Hello?
Yes.
Hi there. I just had a quick question. I came into the conference a little late, and then I kind of got my hands full with my daughter, and I had to step away several times. So I wasn't able to catch the complete audio or the presentation, and I was wondering if it would be available, if that would be made available to us.
Absolutely. We recorded it just for that
Awesome.
purpose.
Okay.
And we will put a link to the recording on our website. So when you have time, you're able to go back and listen to it if you'd like. In addition, we will send out some links to the information that we've talked about to everyone
Great.
who's participated on the call today. We'll send it to you by email.
Awesome. I really appreciate it.
You bet. Thanks for asking your question.
Yep. Thank you.
I'm wondering if anybody thinks or can sort of envision how this kind of proactive planning would be useful to you and to your child.
Hey, Carolyn, this is Jamie. We actually used a trimmed-down version of this form that my daughter's para carried in her backpack on field trips when she was in summer care. And I thought that really helped me feel like if anything happened at the pool or anywhere else that there was someone there who had the information and knew what it was for.
Great example. That's a really great example. Thanks, Jamie. How about anybody else?
This is Terry. I really liked the point about putting things on there that may be atypical but are typical for your child. Like that's something I might not have thought of. You know, like, maybe if they have trouble communicating, this is what they always do when they say yes or no or whatever. I thought that was a really important thing that I wouldn't have thought about. I would have thought about the medications and, important surgeries and doctors and stuff, but I thought that was an interesting thing to add.
Yeah, I think that's a really great point. Yeah. So one time, quite a few years ago, my child was ill, and it was, of course, in the middle of the night. I don't know why this stuff always happens in the middle of the night, but my child was quite sick, and we went to the emergency department, and he ended up being admitted. And I had this really great plan of care, and I was shot. I had actually been trying to keep my child at home and had been caring for him kind of night and day for a couple of days, but it just didn't work, and we ended up being admitted. And I was so worn out. I was so tired. But, when you get admitted, the residents come in and the medical students come in, and they want a history, and they want you to spend a half an hour going through, was your child born at, at full gestation, and how much did he weigh, and, how many surgeries has your child had? And they want all this information that at 2 o'clock in the morning, there was no way I could do this. So I just handed them this plan of care and said, I can't do this now. I'm too exhausted, but here's a really comprehensive overview of what you need to know. And if you have specific questions, come back and let's talk again, or we'll talk in the morning. And they all kind of went, okay, yeah, good idea, thank you. And, so I think we need to be able to think about how useful this kind of information in a really good format can help us communicate when we just can't anymore. Any other comments?
Hi, it's Sierra. I'd just like to mention my child uses Children's in St. Paul, and I forgot the title of there's a woman there that had some kind of position, and it was more towards servicing parents of children with special needs. So I was able to talk with her quite a few times when I was taking my daughter to the emergency room, which I pretty much knew what was going on with her. But because her medical history and everything is so vast and her conditions, they want to run 50 different tests before they get to, what you think may be the problem. And around that time she would aspirate quite a bit and was getting upper respiratory infections, and they just kind of all looked the same, and I'd bring her in so she could get antibiotics and things like that. But prior to that, it was really difficult because they're like, oh, she's throwing up, we need to run a shunt series, we need to do this, we need to do that. And it was difficult because they wouldn't really listen to me because of the type of symptoms. Of course, that's a symptom of a shunt malfunction. However, she's just a kid that throws up a significant amount during the day either way. I wish I knew what her title was, because I think that might be helpful to the other parents. They may have access to that already, but that was really helpful. So when I think of the overview of what we're doing, it's kind of like having that lady on a piece of paper and speaking and saying, well, this is what it could be, and this is what it's not, versus having your kid go through the torture of all the testing that's, at times it can be unnecessary. When we have those question marks, of course we want to go through everything, but if you just have a feeling your child might have the flu, or you might have a certain infection here or there, it's it just feels unnecessary and stressful to go through all of that. So I really like this idea, and I'm excited to implement it.
Great. Yeah, I think we, especially when our kids have a lot of needs and complex conditions, it's very easy to be always in this mode of going from this problem to the next problem to the next problem, and it's really hard to step back and take a moment and really be proactive rather than constantly reactive. And I think that's what most of us parents end up doing, is we often end up being reactive to what's going on and constantly in that reactive mode. And this is really encouraging everybody to be proactive and to work with your children's physicians to be proactive and to have those proactive plans. And I'll tell you, it really can help avoid unnecessary tests and procedures, as you've just heard Sierra mention. It also can really help prevent unnecessary emergency department visits, and can really help stabilize your child's care and your life a little bit. So I just encourage you to think about this, and we will send out more information. And I really appreciate everyone's participation today. And we're just about out of time, but if there's any other last-minute questions or comments, we'd be happy to hear them. Well, thank you, everyone. I really appreciate you being on the call today. And again, please give us a call and get in touch with Family Voices if there's information that we can provide. And we're happy to talk with any parent anytime. So please give us a call, and we'll be watching for a follow-up email on this with additional information about this webinar. Thank you. Bye-bye.